All right, today we are diving into labetalol, a really key player in the fight against high blood pressure. But what makes this drug so fascinating isn't just that it fights, it's that it wages a war on two fronts at the exact same time. And that brings us to the big question, doesn't it? How on earth can a single pill manage to calm down the heart's powerful engine while also telling the very highways it pumps blood through to just relax? Let's get into it.
So, before we can really appreciate the solution, we've got to understand the problem that Labetalol was specifically engineered to fix. And it's a huge one, a condition that affects millions and millions of people: high blood pressure.
When you get right down to it, hypertension is all about pressure. I want you to imagine a plumbing system that's just running under constant, way too high force. Well, that strain is going to wear down the pipes and seriously overwork the pump. In your body, that pump is your heart, and those pipes, those are your blood vessels. So you can see why managing this pressure is absolutely critical for your long-term health.
And this is exactly where labetalol steps in. It's a prescription medication designed to do one thing really well: lower that pressure. It works by basically getting in the way of stress chemicals, like adrenaline, that are telling your heart to pump harder and your blood vessels to squeeze tight. But it's the way it does this that makes it so incredibly special.
So how does labetalol actually pull this off? Well, it uses what we're calling a two-pronged attack. This dual action mechanism, this is the secret sauce. It lets the drug tackle high blood pressure from two completely different angles all at once. Okay, so the first front of the attack is something called a beta blockade. The easiest way to think about this is that it's calming the body's engine, the heart. Labetalol basically blocks these specific docking spots on heart cells where adrenaline would normally connect. By blocking them, it's telling the heart, hey, slow down, pump with a little less force. This seriously reduces the heart's workload and, of course, lowers blood pressure.
But here is what really sets labetalol apart from the pack. The second front, an alpha blockade. So while it's busy calming the heart, it's also working on the body's highways, your blood vessels. It blocks a different set of docking spots on the vessel walls, which causes them to relax and widen. This gives your blood way more room to flow, which, you guessed it, reduces pressure even more.
And this chart just lays it out perfectly. A standard, pure beta blocker, it only does that first thing. It just calms the heart. But labetalol, well, it's a dual agent. It does that, and it relaxes the blood vessels. It's this 1-2 punch that creates such a powerful, effective result. And get this, the drug is precisely balanced. When you take it as a pill, its power is actually weighted more towards calming the heart. It's a beta to alpha blocking ratio of 3-to-1. Now remember that number, because it's going to change in a pretty important way later on. Okay, so we know how it works, but when do doctors actually reach for this thing? Given its unique mechanism, let's look at the key situations where this specialized tool gets deployed. You could say labetalol has three primary missions. First, it's used for the everyday, long-term management of high blood pressure. But it's also a total go-to in hospital emergencies, when blood pressure suddenly spikes to dangerous levels. And, this is really important, it's considered a safe first-choice option for managing severe high blood pressure during pregnancy. A big reason it's so versatile is that you can get it in different forms. If you take it as a pill, it gets to work within a couple of hours, which is perfect for that day-to-day management. But in an emergency, it can be given through an IV, and the effect is almost immediate. We are talking 2 to 5 minutes. And hey, remember that 3-to-1 ratio we talked about for the pill? Well, when it's given by IV, the whole formula changes. The ratio becomes a much more powerful 7-to-1, with a way stronger effect on calming the heart. This is basically tailor-made for getting a really dangerous situation under control fast. Now, obviously, a tool this powerful and this fast-acting requires a crystal-clear understanding of safety. So let's go over the essential safety briefing, what you absolutely have to know before this drug is ever used. First things first, this drug is not for everyone. Since its whole job is to slow the heart, it is off-limits for people who already have a very slow heart rate or certain heart rhythm problems. It's also avoided in cases of severe heart failure and, this is a big one, in people with asthma. Why? Because that same beta-blocking action that's great for the heart can unfortunately also constrict the airways in the lungs. Okay, now listen up, because if there is one thing you take away from this entire explainer, it is this. Medical guidelines are incredibly clear about this for a very, very good reason. You can't just stop taking labetalol cold turkey. So why is that?
Well, your body literally gets used to the drug's effects. If you suddenly rip it away, the whole system can go into overdrive. This causes a dangerous rebound spike in blood pressure that can lead to some really severe consequences. Anytime someone stops his medication, it has to be done gradually under a doctor's close supervision. And like any medication, it does have potential side effects. The most common ones are actually directly related to its job of lowering blood pressure. So it can cause dizziness, especially when you stand up too fast, as well as fatigue and sometimes nausea. And for men, it can also cause issues with ejaculation. And then there's this one. It's a really specific and kind of memorable side effect. Some people who take labetalol experience this strange but totally harmless tingling or numb feeling on their scalp. It's a well-known quirk of the drug that doctors actually look out for. So let's wrap this up. What is the final takeaway from our mission today? It's time for the debrief. Let's summarize what makes labetalol such a uniquely important medication. Here's its profile in 3 simple steps. First, it is a unique problem solver for hypertension. Second, its killer advantage is that dual action mechanism. It calms the heart and relaxes blood vessels. And third, all of this makes it an incredibly versatile tool, essential for everything from daily care to life or death emergencies. And that really leaves us with a final thought. Labetalol's incredible success comes from tackling a single complex problem from 2 different angles. It really makes you wonder, what other tough challenges, maybe in medicine, maybe somewhere else entirely, could be finally solved if we just found the right way to fight them on 2 fronts at once?